So, hello. I want to say welcome to everyone joining us on day 4 of our Autism Acceptance Month and week of events. We are so excited you all are here. My name is Ashley Richardson, and I am the Autism Spectrum Education and Outreach Administrator within New Student Services. And I am also the administrator for Longhorn Ties, which is a new support program supporting students who identify as being on the spectrum or neurodiverse on campus. So we are excited you all are joining us today for our trauma and neurodiversity discussion. I just want to highlight a little bit about this week's events. We have had a great time this week, y'all. We have had a lot of great panels. We've had a great come and go event celebrating neurodiversity and autism acceptance. And we will put in the chat an archive of all the videos, including this one. If you are like, oh, I want to listen to this panel again, you will have an opportunity to. We are posting them all on our Autism Acceptance Month website, which Catherine posted in the chat, which is really great. And check it out. And that also includes our student Q&A, which is really great. You got to hear our neurodiverse students telling you what it's like being neurodiverse on UT Austin campus. I am going to go ahead and get us started myself. I am going to be helping moderate this panel. And a little bit background with myself. I've been working with students with autism and other developmental disabilities for about 10 years, and I'm a licensed clinical social worker. And I love this topic and have personal relations with this topic. So I was really excited when our graduate student, Catherine, suggested this. And so I'm going to let her introduce herself.
Thanks, Ashley. Like Ashley said, my name's Catherine. I use she, her pronouns, and I am a graduate student in social work in my last semester, getting ready to graduate with my master's of social work on the clinical track. Thank you. And I'm, like Ashley said, excited to be co-facilitating this panel. Just a quick note before I turn it over to our panelists to introduce themselves. This is a panel on trauma and neurodiversity. So just a blanket content warning that we will be discussing trauma and topics related to that. We'll also ask that our audience respect what our panelists share and keep that within this space. I know that we're recording it, but please just keep anything to yourself unless you're sharing the recording. So with that, I will turn it over to our panelists. We have Dr. Nick Winges-Yanez, we have Laura Buckner, and we have Fawn Rose Brown. And I'll start with Dr. Nick. Could you introduce yourself, your name, pronouns, how you came to be on this panel?
Hi, I'm Dr. Nick Winges-Yanez. I use she, her pronouns. I am with the Texas Center for Disability Studies and the coordinator for critical disability studies at UT. And I actually came to be on this panel because of Laura, who suggested, since we do a workshop training on trauma and trauma-informed approaches for kids who have experienced trauma and also have an intellectual and developmental disability label. So we train professionals out in the community. And then I also identify as neuroqueer.
Thanks, Dr. Nick. Laura, could you introduce yourself?
Sure. Hi, y'all. I'm Laura Buckner. I am also with the Texas Center for Disability Studies at the University of Texas. I am one of the older members here. I've been at the center since 2006. I'm a former special educator. Sometimes I like to call myself a recovering special educator. I am also a licensed professional counselor, but my greatest, in my opinion, my greatest source of expertise has come from my nearly 32 years of parenting my eldest son, who was diagnosed when he was 3 months old with a disease we'd never heard of before, presented with really scary seizures, and still has an intellectual disability as a result of that medical condition. But autism is a frequent co-occurring diagnosis with that medical condition. So while my son doesn't officially carry the label of autism, he has autism. Um, and so I have 31, he'll be 32 on the 4th of July, almost 32 years of experience. And as Nick said, she and I are co-training a curriculum called Road to Recovery, Trauma-Informed Care for Children with Intellectual Developmental Disabilities, was funded by and supported by the Hogg Foundation. I have been training that curriculum for over 5 years, but the Hogg Foundation approached us at the center about doing a project, and they funded it to us. We are in year 2 of a 3-year project to train trainers all over the state to train that curriculum. And so we're training, we met with the second cohort of trainers yesterday, and we're training all kinds of very diverse group of people, from local authority staff to clinical private practitioners to university professionals, and family members. Just a really diverse group of folks, with the goal of increasing the recognition that trauma happens to people with developmental and intellectual disabilities far more than we have ever recognized, and that we need support in the community, trying to find someone who says, I will see your child with autism, or I will see your child with whatever. Families run up against a brick wall. And so part of that goal is to increase capacity statewide. I'm happy to be here.
Laura.
Thanks.
Yeah, thanks, Laura.
And last but definitely not least, Fawn Rose, could you introduce yourself? And I'll pick on you two to share your major and your year in school.
Okay, cool. Yeah. Hi, everyone. I'm Fawn Rose. I use they, them pronouns. I am a student at UT. Found out about this panel through being a participant in Longhorn Ties, the program that Ashley mentioned before. I am a 4th year, but going to be 5th year chemistry student. I also study comparative literature, and I think I'm going to get a minor in German and Scandinavian studies as well, because I found out I could do that since I learned Norwegian. Anyways, so yeah, that's a little about me. I'm a student and also a student advocate. I've been doing a lot of work to try to make UT more inclusive of non-cisgender people. So yeah, and we can talk about that a little bit more in a bit, I think, with the policy that I have in the works right now. So yeah.
That's great. And I do want to applaud Fawn. When we were, doing this panel and trying to come up with things, Dr. Nick and Laura both said it would be great to have a student voice. And a lot of students aren't always willing to jump on panels. And so I want to thank Fawn so much for willing to join us today. And before we get started on some of the questions, I forgot to thank Dr. Nick and Laura with our collaboration with Texas Center for Disability Studies for this panel. We have had a lot of collaborators this week, and Texas Center for Disability Studies is one of them, and they were gracious to partner with us for this panel and some of the other panels you saw this week. So I definitely want to give a shout out to them before we get started. So thank you both. So we are going to just start this conversation. I think Catherine's going to kick it off here.
Yeah, we have been talking about autism and neurodiversity all week, and it could be useful to slow it down for just a minute here and talk about what that actually means. So I'm curious to hear from our panelists how you define neurodiversity. And Dr. Nick shared she identifies as neuroqueer. Maybe you could get us started and jump off with what those terms mean to you.
Defining things is not my strong suit, but I'm going to try to do this. So neuroqueer just really resonated with me when I came across the term. I am neurodivergent, late late diagnosis, but always been like, there's something. And so when I saw neuroqueer, it just really resonated because I also identify as queer, which is a just anti-conformity, really, not defaulting to a cis hetero or cis gender kind of orientation when we're talking about things as that being the normal. And so neuroqueer kind of aligns with that in a way of not conforming to the way we assume folks should process information or should socially exist in the world. And I have this great quote to help me with my definition because I'm not so good, from Melanie Yergo, I might be saying that wrong, who wrote Authoring Autism. And it's a quote that says, a neuroqueer individual is an individual whose identity has in some way been shaped by their engagement and practices of neuroqueering. If you're neuroqueer, then you neuroqueer. And I just think that's really fun. And I think of it in ways that I've suddenly start to accept some of the ways that I exist in the world, like having a STEM toy. I generally have one all the time. And I used to not, or I used to do it very covertly because I knew it wasn't part of the norm. Not everyone had fidget toys, or as they're called. And so I finally just said, forget it. I'm not going to try to hide it, or I'm not going to try to erase that part of myself by taking something like a beta blocker, which is a medication, in order to reduce any anxiety. And Laura also, mentioned I rock. And when I'm teaching in class, I walk around a lot because I feel like if I stop, my whole thinking process stops. So I do move around a lot. And so I do rock when I'm standing in front, just to kind of keep my brain moving and thinking about things, but also kind of embracing that part of myself and embracing the queerness of existing in the world a little bit differently. So that's how I kind of define neuroqueer.
Thanks, Dr. Nick. I'm going to push back a little. I think you did a pretty good job defining those terms. So I wouldn't say you're not good at definitions. Fawn put something in the chat about autogender. Fawn, do you want to say anything about this question or leave it to the chat?
No, I can talk a little bit about it. Yeah, I feel like neurodivergence is a lot more blanket term than I feel like I've seen it used, really, which is pretty cool because I feel like I only really came to terms with my own neurodivergence recently, because I have a sister who was diagnosed with autism when she was like 2 and I didn't have that same diagnosis. So yeah, and then going along the same lines as Dr. Nick, as I mentioned in chat, like I found the term audi-gender, which is basically like experiencing gender differently, like due to autism, and I resonate a lot with that because while I like just kind of say like, oh yeah, I'm non-binary, I use they them pronouns, like I feel like it's a lot more complicated than that, and I resonate a lot more with like my special interests than people seem to realize about it. So yeah, that's kind of my take on things.
Thanks, Fawn. Laura, do you have anything to add to this discussion?
I don't think I can possibly add anything. That was brilliant on both their parts.
Yeah, I think they definitely summed it up very well, of just kind of neurodiversity and neuroqueer, because that has those two terms have been used a lot this week. So, and that helps with our conversation. So when we're talking about neurodiversity, right, and neurodiverse individuals and trauma, in from y'all's experience, can you explain kind of how trauma may be different for neurodiverse individuals compared to quote unquote neurotypical? Laura, do you want to start with that one?
Yeah, I will start with that one. And I will be very honest to say that when I was first approached a number of years ago by a good friend who has a daughter with autism, same age as my son, and she had come across the concept of trauma and trauma-informed care for the first time as it related to her daughter. And she told me, this is what we're missing. And embarrassed, but honest to say, I blew her off. I thought, no, my son hasn't been traumatized. We haven't been traumatized, no. And then I was introduced to the person that she'd heard speak, and it just blew my mind open because, dear God, we had experienced incredible amount of trauma, as had my son. I had a very narrow definition of the word trauma, and that was my problem. I thought of trauma as the commonly, and I think this is true of a lot of people. I thought of trauma as like a terrible car accident or sexual assault or, your house burning down. I had those big T ideas of trauma. And I just hadn't ever used the word trauma to define what my son was experiencing, what we as a family were experiencing. My son at 3 months of age, when he was diagnosed, at 3 months of age, he was in an MRI machine. It was traumatic for him and us both. And then we were taught the next day, how to give him injections in his little baby legs. I thought I'd pass out. That was traumatic. And as years went on, part of my son's medical condition causes really difficult behaviors to manage. And I wonder if a lot of his behaviors weren't trauma induced or trauma responses, but we were ignorant of all of that. And so a lot of the things that we did to try to manage behavior probably increased the trauma for him, as well as the trauma for us. We had a lot of physical abuse from him as he was growing up and property destruction. And all of that was trauma, but I just had never used that word. And when I did, it just blew my mind open in terms of what we had missed, what so many are missing. And it's really a big impetus for the Road to Recovery curriculum, because kids with intellectual and developmental disabilities, including the label of autism or neurodiversity, often have different behaviors that we try to manage with behavior management techniques that increase the level of trauma. And so we're trying to really get people to instead look at behavior as a form of communication. So that was my introduction to trauma. I had to expand my definition. I think we have to look at, especially with people with any kind of medical conditions or diagnoses, we have to look at the possibility of medical trauma. Some of our folks have long histories of pretty invasive medical procedures, and those can be traumatic. So that's my definition of trauma with my new hard to come by understanding. But I wish I had known it 20 years ago, but I didn't. Nobody was talking about trauma 20 years ago.
Yeah, they weren't. And that's, I'm gonna hold on to something you said about behavior management, but I wanted to give Dr. Nick and Fawn, do you all want to respond to this particular question, either one of you?
I mean, I think that Laura did a really beautiful job of kind of explaining this idea of trauma is something that extends beyond what our, traditional understanding of is, but also recognizing that there are new concepts that we're constantly learning about, like intergenerational trauma. That happens from generation to generation. Trauma that's happening in our world right now, we all know COVID, right? We're all experiencing collective trauma from that as well, and realizing that this will have repercussions for the rest of our lives in different ways in our bodies, in the way we interact with people. But thinking about all of the other traumas that are kind of happening in the world, the racial trauma that's happening, the having to see violence happen to a specific group over and over can be traumatic, right? On top of everything that's happening, and just kind of sitting with that, I think, and recognizing that as something that's happening right now, and that we might not see the repercussions or the outcomes of that, taking it in for years, but that somehow it's there.
Well, and if I can add to that, because I think it's true for the university, we're just now beginning to recognize that so many of the systems that are intended to help can be traumatizing in themselves. I recently told a lead person at the Health and Human Services office that their envelopes create a trauma response for me. When there's a big white envelope in the mailbox and it either says Social Security Administration or HHSC, I have a trauma response. Oh, dear God, what do they need now? What is, what are they going to try to cut off, or what do I have to fill out? Just the systems that people often use, from the special ed system in the school to Social Security to whatever else, can create system trauma. And they're all with great intentions. They don't even realize how traumatic their stuff can be for us. I got a letter last week that said my son did not qualify for his Medicare savings program because he had a projected income of $1.59 over the limit. And then it had a long line of letters and numbers that referred to the rule that this referred to, and I couldn't find it. So that's system trauma. And I think we as a university have to think about, are we inadvertently creating some system trauma for folks?
Definitely. Fawn, you have anything as a student, as a neurodiverse student?
Yeah. Hi. Yeah, I think one of the most important things to think about when tackling this question is intersectionality, because on top of being neurodivergent, I'm also chronically ill, and I'm also trans. And, Laura mentioned medical trauma earlier, and I have experienced like both ableism and transphobia within a medical setting. So there's just kind of this compounded trauma that can exist there. I think it's just really important to recognize that a lot of this stuff, like I'm a whole person that has multiple identities that can all be impacted with where I experience trauma. I also think it's important to recognize how sometimes, at least me as like a neurodivergent person, it's hard for me to pinpoint when I've experienced trauma or when I'm being like taken advantage of. It takes like a lot of reflecting to figure that out. So yeah, that's kind of where I'm at with that. And I definitely align with what Laura was saying about UT. It's a very bureaucratic system, which leads to a lot of things that could either be swept under the rug or when trying to be dealt with aren't dealt with in like a good way, if that makes sense, in a sensitive way.
No, it definitely makes sense. And I love how you both brought up that systematic trauma that sometimes we forget, even in a university system, of things that are created that sometimes, we don't think that they're created to cause any type of trauma, but that can induce trauma. Laura, I do want to piggyback before we go to the next question. You did say something about behavior management and how different behavior management techniques or therapeutic services can cause trauma. So I wanted to give you an opportunity to talk about that a little bit more, and even the panelists kind of give your insights and thoughts about different behavior management techniques and how that can lead to trauma or may not lead to traumatic experiences for our students.
Well, my experience with behavior when it comes to children with, or adults even with differences, is that it's all about managing, controlling, or eliminating, as opposed to understanding what the behavior is trying to say as a form of communication and supporting the person responding to the behavior as a form of communication. I can tell you in my own home that we have gotten a whole lot better responses when we've been able to respond to his behavior as a form of communication and then respond in a supportive way rather than, in schools or I think in a lot of families, in a lot of settings, even professional settings, the response is to try to manage it with medication or with therapeutic techniques or to eliminate it, control it, or eliminate it. And what we have found when we really listen to behavior is that our efforts to manage, modify, or control usually exacerbate the behavior and make it bigger, make it worse. I don't know if that answers your question.
Mm-hmm.
No, it does, Dr. Nick.
I think that, Laura, like what you're saying is so true. And I think that when we're talking about neuroqueer stands in almost exact opposition to that by taking pride in existing differently in the world and not feeling like you have to conform. But I also am thinking about how some of those techniques are to control or to stop, right? And yet we are asking these very same folks to respect or listen to these various rules or whatever, while we simultaneously ignore their own communication, their own requests, right? Their own existence. Like at the same time, like listen to how you are supposed to be in the world while I say that the way you are existing is completely ignored, just not paying attention to it. And I think that's where we do see a lot of trauma happening because folks are trying to mask, which takes a lot of energy, or folks are trying to change the way that they just holistically and organically exist in the world and meet standards that don't make any sense to them. And there is a really great video that I've talked with Laura about called In My Language by Mel Bags, where they talk about how they are a non-speaking person and how they're always expected to understand everyone else, but no one's expected to understand them.
That was the whole word. I want to do like how the students say, like a retweet that, or I'm not cool. But that was a whole statement there, which was really great. Fawn, I know you're laughing at me because I didn't say the new terms, but that was definitely great.
I just had a thought occurred to me listening to Dr. Nick and Laura about controlling, stifling behaviors and how masking plays into that. And I'm just thinking of Proctorio, which is an anti-cheating software. I think I can explain it like that. And Ashley and I hear from a lot of Thai students that it is extremely stressful, borderline traumatically stressful to have to mask constantly while taking an exam. It will, I think, ding you if you look away or if you're fidgeting too much. So they really feel a lot of stress and anxiety around that software. I'm curious, I saw Dr. Nick reacting as soon as I said the name. I'm curious if anybody has thoughts about that software.
I have been following a lot of this as in critical disability studies and looking at all these like new ideas to help us be online and reading a lot of the students' perspectives of this, of how, if you do various things, it counts against you. And I just don't understand how we're creating, and I mean, again, this is systemic oppression, right? Like what we were talking about is making folks feel like they are doing wrong by simply existing. And doing it in this very icky way.
Yeah, I've thankfully not had to have a class with Proctorio in it, but I remember final season, like right before COVID, so fall 2019, one of my friends had like a Proctorio class, and there's kind of like twofold things going on because I had to like come over at like 2 a.m. to give her my computer because one of her special interests is downloading like different operating systems, and Factorio only works on Windows. And so she was having issues there. And then like during the exam, like she couldn't stim, and also she has like really big hair, and like sometimes her hair would get in the way of her eyes and it would like ding her. So Yeah, not a fan of Proctorio. There's way too much, like too many issues with it that like it just doesn't seem like a good way to administer an exam, period.
Creating systemic trauma.
I'm curious thinking about, we talked a little bit about what is certainly not trauma informed. How can trauma informed care be more inclusive of neurodiversity and neurodivergent folks?
I think I'm thinking
think-
of like based of what we've been talking about. Sorry, Laura.
Go ahead. No, go ahead.
Of listening to folks.
That's exactly what I was going to say.
Right? Like
You got to listen. You got to ask questions and listen.
let's listen and believe folks too.
Yeah.
Like I think when we're talking about Proctorio, we are starting from a position that students are going to cheat or do wrong. So starting from that position, right? So starting from the position that we're going to offer some trust to our students. Second, when folks are stimming or doing various things, to pay attention to that and not try to stop it, not try to engage because it might make other people uncomfortable, but maybe have a conversation and listen to folks about that. So, I mean, I talked about for so long, I really, I took medication. I had toys that were very covert. I would put myself in, I did a lot of planning to put myself into situations where I could mask very easily. So, which is not going to happen on Zoom any longer, as Laura can see. And it's very wearing. And so if we just allow spaces for students to possibly turn off their cameras, to move around, and to do various things, I think we're going to mitigate some of that trauma that would be coming from the institution or from some of these interactions. And that's just like a very beginning place, right? There's so much more we can do.
Yeah, I definitely align with what Dr. Nick and Laura were saying with like listen and believe students and just people in general. Um, I I found like okay, so I had a meeting with an advocate a couple of years ago, and she had like a little basket of like STEM toys, and that was one of my favorite things ever. Like I immediately felt so like safe in that office. So that was cool. And also, I appreciate what you said about like video being kind of like a thing that you can turn on or off whenever you need to, because I have had multiple classes during this COVID time require video every class. And it was very stressful, feeling like I had to mask while I was also trying to take notes and also trying to learn. Like, yeah. Also, I want to bring up that I think one of the like best ways that trauma informed care can like be inclusive of neurodivergent people is also like recognizing that like a lot of us experience like are kind of like queer in some way. There's been like a lot of studies based on that actually, which is pretty cool. And yeah, I don't know, I have had a really hard time finding mental health providers in Austin that like have the specialties I need and also will respect me as like a non-binary person. And so I think, again, just like listening to folks and like for me, it's like, hi, I'm telling you, like, I'm not going to feel safe in a space unless you can respect my pronouns and respect me as a person. And that's not just me as a neurodivergent person, it's also me as a like trans person. So yeah, intersectionality again, I think is very important.
Thanks, Fawn, for that. And when you had mentioned just as simple as, mental health providers, medical providers, being very respectful and listening and believing you and just being very open, having maybe not so positive experiences in those arenas can create trauma as well, can be traumatic. And it's like, I don't want to seek out mental health, mental professional help, or I don't want to go to this medical service because of past fears I have. And I know a lot of our students run into that because they've had some type of traumatic experience that they don't want to seek out services. Before we move to the next question, does anyone have anything else to add to that topic there?
I would actually I'm sorry if I'm taking up too much space, but I think
No.
that part of, when we think about how we can do better and listening to students is that we then kind of swing the pendulum the other way and put the onus on students to educate us or educate their peers on, what it means to be neurodivergent or neuroqueer or trans or whatever the experience is. And that's a fine line of listening and being open and inclusive, and not then putting more care labor onto students. And I think that's one of those things that we need to make sure that we're managing really well, of having that space, but then not putting the onus onto folks who experience that particular thing.
No, I definitely agree, Dr. Nick. And that goes to kind of just one of our questions just for the audience and for, us, what can UT staff, students, faculty do to be more trauma informed? And what type of practices can we implement when interacting with others who've experienced trauma? And I think right there, you said one of them is, let our students educate us. But is there anything else that you feel that we as a UT community can do to be more trauma informed? Laura, do you have anything? Do you want to start with this one?
Well, I wonder if a big piece of it is just creating a safe space and using language as you're getting to know your students, that this is a safe space, using language that lets them know you're open to diversity, neurodiversity, and that what you don't know, you want to understand, so that you give them room to tell you what they need. It seems to me that would be a starting place.
Yeah, but don't expect to always get the whole story, which is something that Laura and I talk about. You get to know what you get to know. You don't get to know everything you want to know.
That's right. Respecting privacy as well.
Definitely. And Fawn put in the chat, perhaps even having a resource database that staff and faculty can access so that students don't always have to inform, explain. And I think that just jumped into what Dr. Nick and Laura said. We don't have to know everything. And Fawn Rose just said, I think it's also putting in the work before you enter a classroom to respect and accommodate all students.
I'm having a thought about this. We've talked about Proctorio and some of the harmful practices on Zoom, and it's seeming like more and more things will be moving on campus in the fall. What could that look like in person? I'm thinking about maybe some sensory traumas from sensory overloads, sights, sounds. What could campus do to better accommodate those needs of our neurodivergent students?
I can speak on this one a little bit. So something that I didn't know about for a long time were those quiet rooms that are also where people can go to breastfeed their kid. And I didn't really even know that I could use that room until one of my professors was like, yeah, if you ever get overstimulated in my class, there's one of those rooms across the hall. And I was like, wait, I can use that. So I think just having them telling students about resources on campus and spaces where they can go to calm down, or even giving students just verbal confirmation, hey, you can always take a break if something ever becomes overwhelming. And I also think something that's important that I've only really experienced positively once on campus is professors being open and willing to understand confusing things that are triggering. Like, I have some really weird things that are activating for me, and sometimes they come up in classroom settings. And actually, like one time, one of my triggers came up like kind of unexpectedly on one of my classes, and I emailed my professor afterwards, and he was so nice. He was like, I will like avoid this content for the rest of the unit. It's not like necessary for like understanding. And so it was really cool response, and I kind of wish that was kind of like the norm on campus. Which, speaking of, sorry, I know I'm taking up a lot of airspace, but I also really want to emphasize like the importance of content warnings, because like obviously, as I was just saying, like trauma looks different for everybody, but there are also a lot of more intense topics, like obviously even just like trauma as a blanket term, like things within that, what Laura was referring to earlier as like the big T trauma stuff, right? um I actually just recently, like this semester, had a pretty horrible experience where a professor was assigning readings, and they were very violent and very sexually violent as well, and had given us no warning. And when I emailed her about it, she basically refused to give content warnings, and referred to them like as trigger warnings, which is kind of an outdated term. And then when I like brought my coordinator, my SSD coordinator into it, she technically provided content warnings, but then she like sent me like a 5-paragraph thing how she pedagogically doesn't agree with like trigger warnings. And so I just think it's important to center students in the classroom rather than what one professor thinks about like something, because if we're going to talk about like rape or like violence in class, I need to mentally prepare first. And yeah, anyways, it's just a lot of variation uh, in professor like treatment in terms of that stuff. And I wish that there was more standardization or more training of some sort that could be done.
Well, I'm seeing Andrew made a comment earlier in the chat saying, I think one of the required faculty trainings should relate to this. And I'm wondering if that doesn't make really good sense, because I'm thinking of, like I said, I'm an older member of this group here, and just even the term neurodiversity is a fairly new term to me. And the concept, some of the concepts are the pronoun use is new to me. And it's bound to be new to a lot of other professors and faculty through no fault of their own. It's just we're older and we weren't raised with that language or those concepts. And so I wonder if it doesn't make really good sense to pursue some kind of mandatory training for faculty and professors, just to expand their own level of awareness.
I think that would be really great because there is a disability 101 training, but it does mostly focus on physical accessibility, as someone had mentioned in the chat. And someone had also mentioned how it might be really great to have UTPD in on a training. And we recently there was a student who disclosed there was an incident and disclosed, in the very beginning of the report that they had autism. And the officer taking the report was, like, what does that mean that you can't look me in the eye? And it's like these very outdated ways of thinking about neurodiversity. And again, can be re-traumatizing, right? Because people then have to feel like they have to expend all this energy of educating folks and then also meeting these standards of how to interact with somebody. And so, yeah. And I just wanted to also thank you, Fawn, for sharing what you did and being so vulnerable with us.
Definitely. I wanted to Thank you for that as well. And Dr. Nick, and you're so right, the UTPD training has been, and other trainings on campus, that has been a topic throughout the week. Because for a lot of our students, we had mentioned masking earlier, which is tiring, and having to re-traumatize or explain, okay, this is what's going on, is really difficult, and our students shouldn't have to. And so I had to take a breath when you said that, the officer said that, because then I totally come into bear mode and want to attack, because it's not right. But we want to give time for the audience Q&A. I'm looking at the clock, and we wanted to be cognizant of everyone's time, but also allow the audience to ask questions for the panel. And you can do that either through chat, or unmuting yourself, or raising your hand. And I'm looking through the chat, and we have some great comments there about the quiet rooms and lactation rooms. But yes, we definitely want to open this up for questions at this time.
I do have a question, and I'm wondering if there's any conversation at the university level or like different colleges about requiring so much information when you're trying to submit a letter for disability. I tried last semester and I was never able to get any accommodations, or like it was very difficult to get the letter from my provider and then to submit the letter, like the whole process. So I'm wondering if there's any conversations or any initiatives being taken in regard to that topic.
So, hi. I'm not sure if there are any particular initiatives for intake stuff, but I do want to speak that like I've also had issues with that. I don't have like an official autism diagnosis, and I'm actually only registered with SSD because of some other diagnoses I have. And so it's very frustrating that there's so much documentation that was needed. It took me like 3 semesters to get in with SSD. And I would love to hear if Dr. Nick or Laura have any ideas, or if they can even pass up a message to faculty, seeing if like we could change that, because I know definitely like some folks who didn't get accommodations for at least a few semesters, including myself, on campus because of that.
Yeah, and I'm actually on the SSD faculty committee, and there's been numerous conversations about that. And it just seems like it's not necessarily SSD, like there's these roadblocks because of the red tape with everywhere else, similar to what you're talking about with legal names. And so there's just been a lot of conversation, which can be really frustrating. And so I think that we're still continuing to have those talks, but the more information that we can get with students, even like what we were talking about in previous focus groups of talking about students' experiences, I think this all just is coming to, we're collecting these comments and we're collecting this information. And I think it's going to be really useful when we present all of these cases to the provost.
Thank you.
Any other questions for our panel? The chat has been blowing up with a lot of great stuff, so I'm scrolling through to see if we've missed anything. I do want to point out that Fawn mentioned that there is acknowledged that policing on campus has had an overall negative response for marginalized students. There's actually a queer and trans report committee right now focusing on policy recommendations for policing in other areas on campus on how to do better with queer and trans students, which includes QT, BIPOC, neuroqueer people, etc.
I think just along those lines of also knowing where those various quiet rooms are, which folks are also addressing, like also are problematic in some ways because they're also, for pumping rooms. So we need to kind of expand the access to quiet rooms, but also if, faculty and instructors could also know where, gender neutral bathrooms are, just become more aware of the various access points on campus for students, and making sure that they state those at the beginning, I think can be really helpful. Also, like Fawn had said, an instructor how to address, like if you get overwhelmed, there's a quiet room over here. And like just making that part of our everyday conversation in the classroom, I think can also be really great.
I 100% agree, especially because with gender inclusive bathrooms in particular, there is a map that the GSC tries to keep updated. But some of the rooms that I've gone hunting for a bathroom before, and some of the rooms that are listed either don't exist anymore, or they are like locked or in repair or whatever, like maintenance permanently. And so if the professor just looks around at the building where they're teaching, or even a building over or something, to know where those are, that would be so helpful for me, because there have been times when I've had to just like run across to another building because that's the one I know exists. Whereas I don't know if the one in the building that I'm in actually like is a functioning restroom.
I want to read one thing that Andrew Delatonio put in the chat here. There is an initiative to help train faculty on universal design for learning in order to create better structural accessibility. But so far, it's a small cohort. Let's see here. I do want to allow Fawn to talk a little bit about her initiative before time runs out there.
Yeah, definitely. So another issue that I have been dealing with since I got accommodations, and my friends have as well handled this, is SSD accommodation letters do not honor students' chosen names. Actually, when I was first receiving accommodation letters, they only showed legal first name. And so I can't get a legal name change yet due to financial stuff. And but I've changed my name in the university system. And what that means is when you get an unofficial name change at UT, there are only, well now, okay, so the three places before were diploma, transcript, and then I was the one who actually told the GSC, the Gender and Sexuality Center, about the SSD accommodation letters. Those are the only three places where your legal name shows up anymore. However, starting this semester, your diploma can have your chosen name on it. So woo! But anyways, so I've had this struggle, and so have others, where I've basically been like, ugh, like basically I have to out myself as trans whenever I present my accommodation letters to professors, because now as it stands, it shows names as like legal name and then like in quotation marks my name. And so yeah, I've been working on a policy to recommend basically to like honor chosen names. And yeah, the survey that has been posted by Catherine a couple times is basically a way for me to show student support on the policy. I'm hoping to pass it like at the very beginning of the fall semester. And I'll just be pressuring SSD and stuff to be implementing it, because it would be a very useful thing, because I don't want to have to decide between outing myself and getting accommodations every semester like I have. And so yeah, also thanks for letting me talk about this on the panel, Ashley and Catherine.
Thanks, Fawn. And thanks for taking this on. I'll point out that Fawn is doing this on their own time. And that's a lot of extra work on top of being a student. So really deserves celebration and our support as much as possible. So looking at the clock, I think we're just about ready to wrap up here, and want to express so much appreciation and gratitude for our panelists and for our audience being so engaged in the chat and in the Q&A section. This was amazing to hear all of your thoughts and experiences. We'll be sharing this recording. I love the idea of required trainings on this topic, and thank everybody for brainstorming and sharing their ideas.
And thank you for including the Texas Center for Disability Studies. We were really thrilled and honored to be a part.
Yes, thank you.
Always, always. Well, we look forward to more collaborations with Longhorn Ties and Texas Center for Disability Studies. And as Catherine said, I thank you all for joining us for this panel. I think this chat, out of all the panels this week, has the one been lighting up the most. So we've been having to scroll back and make sure we get to the answers. This topic is very dear to all of our hearts. And I just hear from everyone in the chat in this room that the conversation has to continue, training has to continue, and we have to continue to find more ways and better ways to support our neurodiverse students. So I really appreciate everyone coming today. Thank you, Fawn, Dr. Nick, and Laura for being on this panel. And everyone have a great day.
Thank you very much.
Bye.